Lots of exciting changes. Nadine mentioned IES Phase 2, so Integrated Eligibility System. This is the system that Mr. Espinoza's staff and the DHS caseworkers throughout the state use to process applications, not only for Medicaid, but also the other state benefits. So sometimes we say it is taking like a 1950s Chevy and turning it into a Tesla, right? It's taking a DOS-based computer system and transitioning it into a web-based system. So that's a lot of data conversion. I think we can all appreciate that. It is scheduled to go live next Tuesday, October 24th. What that means for providers who assist consumers with enrolling in Medicaid or other benefits is that the ABE online application will no longer be available starting 5 o'clock tomorrow, and then not again until the 24th. So during that time, the assisters or other providers who help consumers will be submitting paper applications. It also means that the DHS caseworkers are unable to use their computer system. The office will be open on Monday the 23rd, the offices will be, but they're not able to do the work in the computer system while this data conversion happens. So that's just something to keep in mind when you think about operations to get people the benefits that they need. What many of us as partners are excited about is this Manage My Case feature. It is going to be an enhanced customer portal where they will be able to create an account and link to their existing case or their new case. They'll be able to pull up what benefits they have. If they're due for renewal or redetermination, they'll be able to see that. If they need to submit proofs or documentation, they'll be able to do that as well. If they need to report a change, they need to add someone to the household, maybe a newborn. They need to report an address change. Maybe they need to submit medical bills so that they can meet their spend down. They'll be able to do all of this through this enhanced customer portal. We know that many of the community partners in the room and those that we work with will be using this system. It's a customer account, so it's the consumer's account, but we will likely be helping them navigate this system. So we're looking forward to that. We're also hoping that we all don't crash it on October 24th, right? That we don't all get so anxious to try to log in. But EverThrive, in partnership with the Department of Healthcare and Family Services, is hosting a very detailed webinar on this Manage My Case feature, so I'm not going to go into that now, but I've given you the link. So it's on November 2nd. Lauren Polite from the Department of Healthcare and Family Services will walk through this feature, this new function. So that's where we're kind of directing everyone to go to get more information about Manage My Case. Mr. Espinoza, do you want to add anything, or not to put you on the spot? Excited.
Excited about it. It's going to be different. It's going to be slow at first, like everything that is new. But we're hoping to actually, with time, provide better services for the customers more accurately and timely. So, looking forward to it.
Yeah. Yeah, with everything, with a rollout, right, there's got to be that adjustment period. So I think that's the message I'm trying to give to community partners when we train, like, be patient. We'll get there together. I think we all have a lot of expectations and we just need to relax, right? Related to this upgrade somewhat is something called the Medical Management Unit, or Office 555. So this is something happening behind the scenes, but more and more what's going to happen is we're going to see DHS work shift to behind the scenes and electronic work. So this currently is the Illinois Medicaid Redetermination Project, but it is shifting, and basically going forward, any Medicaid-only cases will be processed by this office. If it's someone new to Medicaid, the local offices still process that initial brand new application, but then any casework going forward will be done by this Office 555. And that's just because of the address, 155. So a lot of just updates, appeals, anything with medical only. If it is a case that has other state benefits like SNAP or cash assistance tied to it, that will still be processed by the local office. So this is just a quick update. Again, partners who work with consumers will be getting more information about this and how to kind of navigate that. There will be no lobby. This is not an office that people can go to and see a caseworker. It's electronic behind the scenes, and I think DHS's hope is that people in the future will be online, not in line at the local offices. So just kind of an FYI. But really what I want to talk about today is Medicaid Managed Care. So we have been in our region, in the greater Chicagoland region, we have been living with Medicaid Managed Care for a couple of years now. Earlier this year, the state put out a request for proposals, and they are narrowing down the number of companies administering the managed care plans in Illinois. Again, it's all about care coordination, reducing costs, not duplicating services, right? It's managed care. And in certain parts of the state, we did not have managed care. There were parts of southern Illinois and different parts of central Illinois that there was no managed care, but next year they get to join our experience as well. Some people like data, and this tells an interesting story to me. This is showing you the landscape of Illinois Medicaid enrollees in managed care plans. That top bar is families and children. So you can see the most significant population enrolled in Medicaid managed care in Illinois are families and children. And then we've got our ACA adults, and then that third bar is our adults with disabilities. And then the fourth bar, which is tiny but still a very important part, is our dual eligible folks, so our Medicaid, Medicare population. Real quickly, just to clarify, not all persons on Medicaid enroll into a managed care plan. These are just some of those populations. So if someone has third-party insurance, they maybe are employed, they get employer coverage, and they also have Medicaid, they would not be put into a Medicaid managed care plan. Same thing if someone has a spend down, and then all kids premium level 2. So just who does not go into managed care. This is the website where persons go to enroll. They can also call. These are the client enrollment services brokers. Department of Healthcare and Family Services contracts with the group that provides this service. But people can go online and explore what plans are available in their region, find a primary care provider. We always advise consumers to check with their provider, make sure they're still taking those plans, and that they're still taking new patients with the plans. Because as with any insurance product, not just Medicaid, providers have that right to limit the number of persons that they'll accept with any particular plan. And it's not just Medicaid, that's across all insurance products. One of the benefits of the managed care plans is that people can have a care coordinator who will help them navigate the healthcare system if they need referrals, if they need a specialist, if they need transportation to appointments. So care coordination is an expectation that all managed care plans offer. And the managed care organizations must maintain, and this is HFS language, a network of providers, adequate access. And I think these are some of the challenges we've all seen or heard from our clients is maybe their hospital or their provider was accepting the plan and then is no longer contracting with the plan. And we are still waiting to see, considering that the new RFPs have been issued and they're effective, the service is effective January 1, it's safe to presume that many of these MCOs are still working on building up their provider networks. But that has been a frequent challenge that I hear from consumers or other providers seeking assistance with navigating the system. And then just a little bit that every MCO, there are grievance and appeal processes in place. Thanks to Evie for that. And also continuity of care. So that if my provider does leave the plan that I have and I'm not eligible to switch plans yet, that I can request a continuity of care, and for 90 days, if that provider is willing to bill, I should be able to continue my treatment with them until I find a provider in my new plan. There's a little more detail to that, but for purposes of today's discussion, that's in a nutshell. Now, this is what happens whenever someone is new to Medicaid. They're brand new, applied, they are approved. They will get approved for Medicaid, and during that initial time, they're what's considered fee-for-service. They can go to any provider that accepts straight Medicaid, and then they will receive their enrollment packet, and they have 60 days to pick a managed care plan and a primary care provider. If they do nothing, they will get a second notice that will say, hey, you haven't done anything, you're going to be auto-assigned to this plan and this provider if we don't hear from you by whatever date. We want people to voluntarily enroll, right? That's kind of been the rub. So anyway, once enrolled, whether it's by their choice or auto-assigned, then they can use providers in the network. Once their coverage begins with that managed care plan, they have a 90-day switch period in which they find out, oh, my provider isn't in this plan's network, I want to switch plans. They only have 90 days to do that. After that, they're locked in for a year, and then they can, at the end of that 12-month period, they'll get another 60-day open enrollment period. What's challenging is that their Medicaid redetermination, their renewal for Medicaid, usually doesn't line up with their open enrollment for their managed care plan. There's often a month or two delay, sometimes longer, depending when they actually were effective with their managed care plan. So these are some of the steps that we navigate consumers through. But these upcoming changes, what's happening? We've had all these different types of managed care plans: integrated care program, family health, ACA adults, long-term services and supports. I can tell you more about those later if you want the details, but essentially those plans are all being rolled under the umbrella of Medicaid Managed Care program. Our dual-eligible Medicare-Medicaid Alignment Initiative, or MMAI, is not part of these changes, and that's due to federal Medicare rules. These are the plans that are awarded starting 2018 going forward. 5 of the plans are being offered statewide. County Care and Next Level will operate in Cook County only. And then any DCFS youth, so the wards of the state, persons whose health care are being managed by DCFS, they will all be put into one particular plan, the Illini Care Health Plan. And it's anticipated, due to some transition and all of that, that's probably going to happen July of next year, not right away in January, but something to keep in mind. So these are the plans awarded. This is the state's breakdown of their regions. You can see we fall into Region 5. It's just kind of the way they've organized the managed care regions in Illinois. And most importantly for our consumers, so consumers who are currently in a managed care plan, they will start getting notices later this month, the last week of October and through November. If their plan is still offered, those notices will start going out the week of October 30th and will continue into November. If their plan is still offered, they have the option to stay in that plan, or they can change to a new one. They only have 30 days to respond. Let's hope they open their mail right away when they get it, right? If they do nothing, if they don't respond, they'll remain with their current plan. If their plan is no longer offered, let's say they were in an Aetna plan and that plan is no longer offered, they have to choose a new plan. Again, 30 days from that notice being received to let the state or let HFS know who they want to go with. If they do nothing, they're going to be auto-assigned. Now, the state is going to try to make sure that they can keep their same PCP. They have an algorithm to figure that out. But we know that sometimes people end up in plans that they don't want. For both, the new effective date is January 1. The good news with all of this is come January 1, both groups have a brand new 90-day switch period. It's almost like the state is resetting everyone's managed care re-enrollment dates. So that's the good news, and that's the message to get consumers. If they miss, this 30-day window to switch plans, come January 1, they will still have 3 months to make a change to whatever plan meets their needs. And hopefully by then, we'll have a good idea of what the provider networks will be. Enrollees in other parts of the state, just so you know, that's a little bit more delayed. Their estimated effective date will be April 1. So these are our friends down in central and southern Illinois who will be new to managed care. For more information, you can get all sorts of documents on the HFS website. You can get the model contract of what all MCOs are supposed to be offering, notices that are going out to consumers. You can get the actual copies. They just released that, I think, yesterday, was the notices published. And I already mentioned this, that the transition date for the youth in the care of DCFS is still being finalized, so stay tuned about that.